Hello, I am Dr. Bree. I'm a physical therapist and I have over 15 years of experience focusing and specializing in pelvic health. And I also have a lot of experience working with wonderful people like today's guest, Nicola, who I'm going to be introducing in just a moment. We're going to be talking about normalizing prolapse and also prolapse surgery for those people for whom surgery is the right option for. But first, before we really get to talking and before Nicola shares her story, I want to share three really important things. So first thing is that this is one person's perspective. This is Nicola's perspective, and everyone is different. So please, as with anything I do, take what resonates and leave the rest behind. And secondly, this is not medical advice. This is YouTube. So it's really important that you have a conversation with your healthcare provider about what is right for you. The third thing is that neither one of us here on this interview today are necessarily proponents of surgery as the go-to option for prolapse. Both Nicola and I, we're going to get into this. We both are all for a conservative approach as a first line of defense for most people with prolapse. But again, this is where everyone is different. And for some people, surgery is the best option. So we're going to be talking about that. And really just our aim today is to break the stigma and the taboos around prolapse, pelvic organ shifts, and also surgery as an option if and when that becomes the right choice for a person. Okay, so with all that being said, I'm really going to turn it over to you, Nicola. I'm so grateful that you have agreed to be here and share your story and just share your wisdom and perspective and your experiences with this. So thank you for being here. You've been an amazing client to get to know over the years, just on a professional level, but also as a friend and just a person. You're amazing. So thanks again. And let's get to your story. So take us in a nutshell up to today and what brought you here?
Yeah, sure. Kia ora, I'm Nicola Brown. I live in Ōtepoti, Dunedin, which is Ōteputi's on the South Island of Dunedin. Our claim to fame here is that we have the steepest street in the world. So, that's a thing that we're very proud of here. We had that title taken off us a little while ago and we got it back. So that was exciting. We fight for things here, and that is part of the theme of what I'm going to be talking about today. My son is now 15 and a half, and I, as far as I know, didn't have prolapse before I had him. I might have known. I might have had it and not known. I'm not sure. About 6 months after he was born, I was just having it was a difficult delivery, really difficult. There were a lot of interventions, and he got very stuck. It was a vaginal delivery, and they used basically every tool in the kit to get him out safely. And at the time, you just that's what you want, right? Like not that you want that, but you want a healthy baby to come out the other end and to not be too much of a struggle for anyone. And it didn't go according to that plan. It was, you don't really fully consent. They just say, can we do forceps? Can we do an episiotomy? Can we use the ventouse? Can we do this? And you're just like, of course, whatever it takes. And so when he was born, neither he or I was very well. I was in a lot of pain. I had a lot of episiotomy stitches, and got a post-delivery infection, and he had trouble breathing to begin with because he'd inhaled so much meconium during the very stressful process of his birth. So we were both in a really rough state. It was a difficult beginning. And so a few months down the track, I was having a checkout with the gynecologist, and she said, oh, you've got a bladder prolapse, which will be from the delivery most likely. But it's pretty mild, and you might need surgery for it one day. It might not cause you any trouble. We'll just wait and see. Let's just see. And I actually knew what prolapse was because I actually worked full-time for a year between high school and university, college, as a rest home nurse aide. So I'd been a caregiver of women who had prolapses. I'd helped shower them and bathe them and get them dressed, help them get dressed. And so I'd actually seen and learned about prolapses when I was much, much younger. And I very much thought of it as an old person's problem, so when this gynecologist said to me, you've got a prolapse, I was like, what? But I knew things felt really different. I could even tell with a mild one that things did not feel the same. And I didn't really think much more about it because she basically said, you know, don't worry about it. This is pretty common after a delivery. And so this is probably quite good advice. You know, this
Yeah.
is 15 and a half years ago. She's like, it's not a big deal. It's just a thing. It's worth knowing. We'll keep an eye on it. And it didn't cause me too much trouble for a long time. In fact, to be honest, I barely gave it another moment's thought, except that I had a little bit of bladder leakage when I ran, but I wasn't huge on running. I could easily manage that. If I just went for a run first thing in the morning when I hadn't had much fluid, I'd be fine. And I wasn't hugely keen on it anyway, so it didn't really impact my life that much. So, but then I went into 2.5 years ago, I was a really, really active person, right? So I was into like skiing, biking, big walks, hiking, dancing. I was really into dance. I did Afro and hip hop dance, so pretty fit. And then I went into a yin yoga class, which was like the most gentle, quiet form of activity that I could do, basically, besides sleeping. Went into yin yoga, had done this class and these moves hundreds of times over the years, but I was under an enormous amount of stress at the time. It had been a really difficult few weeks before this, and I think that's probably a part of why my body was under a lot of pressure. And I did a squat where it was a deep squat, and we held it for a while, and I just felt something go in my pelvis, like it was a horrible tearing sensation. And I knew at the time that it was not good. Like I came immediately out of the squat. I think I laid down. I talked to the yoga teacher afterwards, and I said that squat wasn't good for me. What could I do instead? That's kind of a turning point in my life. Like I was basically had a normal life until that day, and have not really had such a normal life since, because what that gave me was pudendal neuralgia, so inflammation of the pudendal nerve, which is one of the main nerves through the pelvis. And it means that sitting is really uncomfortable for me a lot of the time. Sometimes it's okay, but not if I've had a long day of it. It can be really, really difficult. And I've had that for 2.5 years. So in the process of getting that investigated, of course, I had lots of internals because they couldn't work out what had happened, because it's a very rare and a very unusual injury. There's case studies of about 6 other injuries happening, 6 other people having the same kind of injury throughout the world, and that's all we can find in the literature. So it's really unusual. So I don't want to scare people off yoga at all, but it was just a thing that happened to me. Yeah. And yes, we all have things that happen to us and to our bodies, and it just happens to be my story. So don't be scared of yoga. Obviously, saying that to you, big fan of yoga. And I still am. I still actually help teach a trauma-sensitive yoga class every week, and I love it. So in the course of getting that investigated, incidentally, I could then feel like I was investigating inside myself, and I'm like, what's this? And I could feel my bladder was much more pronounced than it had been. And my wife commented too during sex that something seemed different. And so I go to the GP, and the GP said, it wasn't my GP, it was a locum, and she's my family doctor, and she said, oh, I don't know what this is, maybe you've got a UTI. And I don't have any symptoms of a UTI, but okay. So the first GP had no clue what it was. I had to keep cycling through doctors to find someone, and I'm saying, I think this is prolapse getting worse. But it turned out it wasn't just one prolapse getting worse, it was now 3 prolapses. So now it was bladder, uterus, and also rectocele. So I've got like a really unusual combination of things. And I'll say that too. When you say this is one person's experience, this is my unique combo of pelvic kind of mayhem. And I say that kindly, but it does feel like mayhem a lot of the time. And I have tried absolutely everything I could possibly think of. I discovered your channel, Bree, through actually figuring out for myself before any of the doctors that I saw figured it out. I think I've seen like 9 or 10 doctors about it now over the years. I figured out for myself, this seemed like pudendal neuralgia just by some pretty extensive Googling. And I'm a clinical psychologist. I know how to look for research. I know where to kind of go online. So I'm looking for reasonably reputable information. And I figured out for myself, this seems like pudendal neuralgia. And the reason I found you, and you were actually one of the first people you helped me before I got to a GP who even identified what this was. Yeah, because of a clip that you've got, I don't know if it's still there, but it was just about stretches for pelvic pain. And it must have been a tag on that mentioned neuralgia, which is how I ended up with you. And so I've done your, lift program. I've seen multiple doctors. I've seen 5 pelvic floor physios, because the combination of things I've got is really difficult for people to treat. I've tried more than 10 pessaries. I've even imported some pessaries because we have so few options, and a lot of the physios aren't trained in many different ones that I can access in New Zealand. I've had antidepressants, I've had pain medications, I've had electromagnetic stimulation, I've had therapy, I've done lots of meditation, I've had EMDR, which is a form of therapy for birth trauma. I've done all the glute, core, pelvic floor exercises that I can find, and relaxation, tried the whole lot. Didn't really get that much further. Hyperpressives are probably one of the things that got me the most progress. And I've just, in December last year, so that's 11 weeks ago, had surgery where I had hysterectomy and I had front and back wall repair. There's no surgery for this nerve issue, but they hoped kind of that lifting the prolapses off the nerve might relieve it somewhat. Hasn't worked that way so far, but yeah, so that is my rather long-winded story so far.
Yes. I mean, it's so much. And as you said, this is very individual. All of it is individual. The fact that you said yourself that you'd done the yoga class, you'd done some of these yoga poses many times, is just for whatever reason, that day, it didn't work for you. And so 3 types of prolapse, pudendal neuralgia, and then you ended up deciding on surgery because you'd done the work. You'd tried the pessaries, you'd tried the programs, you'd tried the exercises, you'd tried the mind-body connection. And really you were just like, I need more. And so let's talk about a couple things here. First of all, we wanted to normalize the fact that prolapse happens. This is really common. Prolapse is an extremely common condition for women. Excuse me, it's about 50% of women who've given birth will experience some degree of prolapse. So that is something to just for people to be aware of and to know that this happens. But as Nicola's showing here, there's a lot you can do to help yourself. First, things you can try. And Nicola tried them all. And I just want to, again, honor you for that. What was the turning point for you though? Like, how did you feel about the idea of surgery? Were you scared about it? Did you have any feelings around surgery? Like, oh, I don't want to do surgery, or this is something I shouldn't do, or this means that I've failed in some way. Did you have any thoughts like that around surgery that you had to get over or not?
Yeah, definitely a lot. I think I would say I did a complete 180 on that to get to the point where I could have surgery, and even leading right up to the days before the surgery. And my surgeon was really aware of that actually, and he said, if you change your mind, that's fine. So he said to me, to get to the point of even considering surgery, I did have to do a 180 in my mind. So initially, I think because where I found the most support was through groups, through Facebook groups, right? Some really great communities online where people support each other so much. And I guess maybe it is partly that people who are still having trouble stay in the groups, that there can be, and there's people who've had really, really difficult and unfortunate results from surgery. And so the kind of voices that I heard coming through about surgery tended to be quite negative. And I also, even from some health professionals that I saw, got a lot of messaging around the surgery having a lot of limitations, particularly for me as somebody with chronic pain. In fact, one of the doctors I saw, who was supposed to be one of the best in the country, I actually traveled the length of the country to see people in different places. One of the doctors I saw said to me, I wouldn't touch you with a barge pole, meaning she absolutely would not do surgery. Now, I'm not a doctor, but I don't think a barge pole is an appropriate surgical implement. Like, I'm like, okay, well, I won't be going with you. I should say I'm a stand-up comedian as well. And so I'm constantly collecting the funny anecdotes through all of this too, and it's part of my way of coping with it. I have a lot of funny material I'm just not quite, I haven't quite gotten courageous enough to do it as a stand-up routine. I feel like the people who would love it are the people in these Facebook groups, right? It's quite a niche audience.
Yeah.
But yes, I initially was like, I don't want to have surgery. I'll do anything I can to not have surgery. I never really had major surgery. I had a few minor things before, but I've never had anything as big as that. And I don't think I felt like I'd failed, coming back to your question, but I kept wondering, is there something else? Like, am I missing something? Is there something I haven't tried hard enough or wasn't consistent enough with, or do I need to change my diet more? Or like, what is it? It's like I'm missing a piece of this puzzle. But the turning point was that my wife and I, we've been together 27, well, more than 27 years, and we've actually been married twice before. We've been married 3 times, but always to each other. So we're quite consistent with it, right? And but the first time it wasn't legal for us to get married, right? That was 2003. We just did our own wedding. And then the second time we got legislation in New Zealand called a civil union. So you could have like an equivalent sort of wedding paperwork thing. So we did that, but that felt very formulaic. It was just to kind of tick that box. And then last year we were like, we've had a really rough few years for a bunch of reasons. Why don't we do something fun? You know, we've kind of come through the other end of COVID. It feels all right to have a ceremony again. And we've had a lot of big stuff going on in our families. Why don't we make something really positive? So we decided to get married, like actually legally married, and be able to call it a marriage this time around. And so we planned a wedding dance, which was my idea because I used to love dancing. And it's one of the things I've given up because of it inflaming the pain so much. And I found it really hard to have to give it up. And I hope I'll get back to it one day. But I asked my dance teacher from years ago, would she choreograph a dance for us? And she did. And we had such a great time. It was Tom Jones. She's a lady. And it was the same music we had as our first wedding dance. And we got little snippets from our original dance, and she put them together with a new one, and she kept it really simple because she knew I was limited in what I could do. It was very simple, and so it wasn't a lot of practice. It was low impact, the whole thing. It felt really good to do it. Within a couple of weeks of practicing that, maybe like 10 minutes a day of practice, my bladder prolapse was so much worse. Like I could feel it, but it felt closer to coming out of my body than it ever had before. I was having to go to the bathroom a lot more often. I was just like, I'm done with this. Like this is not a lot to ask of my body, but it is, and it shouldn't be. And so I just realized I was sick of the half-life, you know, like it felt like I was just kind of keeping things at this level because I had to, but I was like, if there's something else I can do that means I don't have to live that way, then I'll take it. Yeah. So I got in touch with the surgeon and was within 3 months was having surgery. But he did give me the option to change my mind, like right up until the time, which I thought was pretty amazing because he knows that people do.
Yeah. And I think it's actually, on one hand, I actually think even though you heard some terrible things, like I wouldn't touch you with a 10-foot barge pole or whatever, I think it's actually somewhat unique that you did have so many people kind of not jumping to surgery, because I think many people's story is they often hear surgery as the go-to, well, you have prolapse, you need surgery right away. So I think that's actually a unique situation for your case to not have had surgeons or doctors jump to surgery as the first line option. But I think it's great that your surgeon was very open to you asking questions and changing your mind maybe, but you proceeded with it. So I think for your case, I would be in the exact same position, Nicola. Like you just were wanting these simple things like being able to do a low impact dance routine, something that you love and brings you so much joy. And as a dancer myself, I can really relate to that feeling that you must have had. So what did you do? I know that from my perspective, I was really happy that you'd been through my LIFT program to kind of prepare you for surgery in some ways, because even though unfortunately, you know, I hate it when people don't get better with my stuff. I just have to put that out there. Like, I hate that. It drives me crazy when people don't get better. And I knew that in your case, it hadn't relieved your symptoms, but I did know that the information in the program, especially the lifestyle tips about, for example, how to lift things correctly and how to, you know, live your life in certain ways with good posture and breathing and things like that, I knew that would really help you after surgery. And I think that's one of the most important things people can do before surgery, if they choose to go through surgery, is to learn lifestyle tips that will keep them safe and keep their pelvic floor safe before, during, and after the surgical intervention. Was there anything else that you did to kind of prepare your body or your mind for the surgery when you knew that it was going to happen?
Yeah, I again did a lot of searching for assistance. My philosophy in life is if something's not working well, get help. Like, don't try and figure it all out yourself. We don't have to stumble on alone. And so I watched, I have to say, the pretty limited relevant material I could find online. So I know you've got a couple of interviews with people where you talk about surgery. The one with Kim Botney, is it? Yep. Where she talked about rectal surgery. That was really good. And then that took me to her Instagram, where she's got some really good content on there about surgery, particularly around lifestyle and recovery before and after. I tried to follow, the people that I found that I sort of felt like I could trust. There's an Australian physiotherapist called Michelle Kenway.
Oh, yeah.
And she's actually for a long time, like some of her clips are a decade old, and really good, simple tips for women, more to do with hysterectomy, but she does talk about prolapse surgery too, and I think it must be her area of specialty, and a lot of practical stuff about what to eat and not eat and how to avoid constipation before and after. So I tried to follow those lifestyle things as much as I could. I also tried to, for me, they wanted I had to see a pain specialist again before, because they wanted to try and have my pain dampened down if at all possible, because the risk was that the surgery could really ramp that up, and they didn't want to do that if it could be avoided. So I had to increase my pain medications, and I also meditated every day. Well, not every day, I shouldn't, but I tried to meditate most days, and I actually think that got me in a really good frame of mind. I found some great meditations for pre-surgery, just pre any kind of surgery, on Insight Timer, an app that I've got, and I actually think that had me going into surgery in a really great mental frame of mind. I did everything I could anyway, mentally and physically, to try and get myself in a good space. And by the time I got to surgery, I'd done such an about turn. I was actually just really more anxious about something getting in the way of the surgery than anything else. I was really worried about COVID. There was another wave going on here. So I had to stop going to things. I had to work from home. I didn't go to the supermarket for weeks, because here, if you're having surgery, you had to be something like, I can't remember, like 8 weeks clear of COVID. My family and I were doing everything we could. We were back to masking all the time. I had to stop doing comedy gigs because I couldn't be in a crowd. And so I had to make a lot of sacrifices. And so I was just terrified. I was going to get to the day of surgery and do a COVID test, and they're going to go, oh, no, sorry, you got COVID. Yeah. So that was actually my main fear. By the time I got to the surgery, it wasn't so much the surgery itself. It was like, please don't let anything get in the way, because I've got myself ready for this and I just want to get it happening.
Yeah, you were in the right headspace, it sounded like. And I wanted to offer a book that I don't know if I actually mentioned it to you, Nicola, but this is a book that might be helpful for anybody who is facing surgery. It's called Prepare for Surgery, Heal Faster, A Guide of Mind-Body Techniques by Peggy Huddleston. And so this is really similar to, you were already doing it. You naturally were doing the meditation. You were doing just getting yourself in the right headspace. And I think that is such an important part for surgery. So if anyone is facing surgery in the future, check this out. It might be a resource. So tell us then next, because I definitely want to hit upon your experience with surgery and where you are now.
So yeah, I'm 11-ish weeks post. As I said, I had a hysterectomy and front and back wall repair, all done vaginally. I've got dissolving stitches that last 6 months, which I wasn't told beforehand, and I kind of wish I'd known that. So I'd known, okay, you're going to have 6 months of not really knowing how well it's worked. The first 4 to 6 weeks were really rough, like really rough. The surgeon, when I asked beforehand, when did he think I could be back at work? He said, oh, I think with your job, which involves sitting, listening to people, which is already difficult for me because I'm sitting, right? And I'm listening to other people's distress and pain, and I'm there with that. And I think that I can't help but take some of that on board myself sometimes, and they don't know necessarily that I'm sitting there in pain. So he said, I said, when do you think I should be back to work, like theoretically? And he said, I think you could be back after 3 weeks. Well, 3 weeks. I tell you, this man obviously still has his own uterus, right? Like he's got no clue. I love my surgeon. I really, really like him. He's got so many great qualities, but honestly, the things that some people say about surgical recovery are so different from the actual experience of it. At 3 weeks, I couldn't even sit up. Like I was still only reclining or lying down or walking. I had a hematoma, which meant a lot of bleeding, and that complicated things. I had terrible constipation for the first week. I just had a whole lot of stuff, and it was a lot of setbacks at the beginning. It's really
Can
rough.
I ask you, how did you deal with the constipation? Because I know that that is a really common issue, and somebody might be interested in that. What did you do? Did you have anything that really
It,
helped?
it was horrific. I'd done everything I could to avoid it. So I'd like increased my fiber beforehand. I've been taking like kiwi fruit extract, which we have here, which is really good for me usually. I had prepared, like I had all the stuff, like in the Facebook group. There's a really good Facebook group for preparing for prolapse surgery. There's like lists of what you need and what you should take and stuff, most of which I actually didn't need, I have to say. But anyway, there's all these people give you advice, but a lot of it's stuff that we couldn't access in New Zealand. So I was trying to think, okay, diet-wise, what can I do? Afterwards, I didn't lose my appetite. Like I was just eating straight after, well, not straight after, but within a few, as soon as they offered me food, I'm like, yeah, bring it on. And I was drinking heaps of water, even though you sort of don't want to, because getting up to go to the bathroom is difficult. And the first few days when I went to the bathroom, I had to call a nurse and they had to measure my urine output. I had to pee in a bucket, and then they're like, oh, you did this much yourself. And then it was like, oh, it's really complicated. Like peeing isn't straightforward after you've had the surgery. And all your internal organs for me were like, what has happened? Like, what are we doing? We're really confused. Why are we living in a different floor of the apartment? You know, like this is not where we used to live, because everything's been hitched right up to a ligament really high up. So I can't give great advice because I ended up taking, I took the laxatives that they told me to take. They did nothing for me. I took more laxatives, different kinds, still nothing. They hit me with the heavy duty stuff. They gave me an enema in hospital, still nothing. They sent me home and I'm still like, this is a bad scene, because we're up to like almost, I don't know, 4 or 5 days post-surgery and I've just been eating like a horse for some reason. It was terrible. And it was just like I guess it just took its time for the bowel to sort of get back online. In the end, I can't even remember what the turning point was, but it was pretty awful to get to that. And then suddenly it all frees up. My son, in our family, my son's had really major surgery too a year or so ago, and we're very good at looking after each other, and we're really good at talking about bodily things. And he's got this. He's 15. He likes to tell us stuff, and like if he's going to the bathroom, he'll say he's going to drop the kids off at the pool,
Yeah.
which means he's going to do a poo, right? I'm going to drop the kids off at the pool. So we just had all these jokes in my house about I was constantly doing pool drop-offs for the next few days because I just had like busloads of kids to drop off at the pool, like days built up. And it's such a relief. Oh my gosh, the relief when you get past that. But I have to say, bowel stuff is still really complicated. It's not easy. I think my bowel, which wasn't a problem before, has become really still quite confused. And I think that's really common with rectocele surgery. Sorry, in answer to your question, how am I now? I'm not sure how I am now. And I find that really hard because I don't feel like much has dramatically improved. And it could be that it's too soon. I've still got these dissolving stitches. There's still definitely swelling inside, which will apparently still take quite a while to go down. And I haven't noticed any major improvements, which is really disappointing when you've gone through so much. So it may be that it's a work in progress and things are still going to improve. It may be that because my prolapses weren't terrible before, like I'm sure if you had stage 4, or if you had like really, really advanced prolapses, you're really going to notice the difference. And I have thought maybe because mine weren't that extreme, it was partly to try and relieve the pain that we did the surgery, but that hasn't helped so far. But maybe you'd really notice it if they were more problematic to you. So I'm on the fence as to whether it's been worth it, to be honest. That's my like brutally honest take on it at this point in time. And it's kind of disappointing, to be honest. Like I wanted something to feel like it was worth it.
I just so appreciate the honesty of this whole conversation and just really exposing kind of all the possibilities, all the possibilities of things that can happen. And I also want to just honor the fact that you you are showing up though. You're showing up still. And I know that you're going to keep showing up, Nicola, because I know who you are. And you're going to keep showing up and you're going to keep living life and you're going to keep doing your best and you're going to keep this sense of humor that you have, which I do think is probably such a blessing and a gift for your healing and just for your mental health to sustain you through these difficult times. Because let's face it, this is hard. This has been a hard few years. And I want to say from my perspective, there is still a lot of healing in front of you. I mean, there's so much happening under the surface. And this was a major surgery that you had. And so it takes a long time for the body to readjust and recalibrate and fully heal and for that swelling to go away and for, the inflammation to subside. There's so much happening that there's often a really long lag time that people are not expecting. And so to me, this conversation is really helpful for anybody who's expecting surgery to be this instant fix or instant relief. It probably won't be, I mean, the healing process takes time. And so, I mean, we don't know what's ahead for you. And that's another great reality, right? That's a great reality check. But I think that you have such a good attitude and I think that time will tell. And I really want to give you my 2 cents, which is that I know there's still a lot of hope for really great outcomes because it's only been 11 weeks. And even though that's a long time, it's not in the grand scheme of a body's healing. So
yeah, I can get that at an intellectual level, like you can kind of know, okay, just patient. But, the word patient is interesting because you're a patient in hospital and then you have to be patient with your healing too. I was really worried since we get into the nitty gritty here, and I might as well just use this platform to say, because people might wonder, like one of the things I was really worried about was sex afterwards, right? And if it's going to make a difference and how's it going to feel. And there's all this stuff about if you have a hysterectomy, what does it mean if you don't have your uterus and your cervix anymore, etc. And one thing I'd say is being a person in a relationship with another woman has made this in some ways easier because she's very understanding, but also in some ways more difficult, I think, because I can compare my body to hers and it's really hard. Like it's not, that's kind of I guess quite a grieving thing.
Yeah.
To not feel normal. And I guess that was part of what I wanted with surgery. And with all the swelling that you still have, it definitely doesn't feel normal. But so I kept checking with the surgeon, what's going to mean in terms of sex. And he said, well, generally afterwards with this surgery, people talk about, he does a lot of prolapse surgery, like it's his sort of bread and butter, which is kind of what you want, I think, somebody who does it a lot. And he said, generally, but he always acknowledged he's talking about straight couples, heterosexual couples. Generally, people talk about sex being better. And he said, but, with you, things are different, meaning because I've got this pain issue, particularly. But also, I think it must be really hard for health professionals who don't know what it's like to be in a same-sex relationship. They probably don't really know what to talk about with me when it comes to talking about sex. So I'm the one that's sort of having to ask the questions and having to be like really explicit with them. And I think some people would be too shy or too embarrassed or whatever, but I used to work at a fertility clinic and I'm very used to talking about through my job, very intimate issues with people and just being really matter of fact about them because it's all just body parts, right? Like it's all just body parts. We don't have to judge one area and make it taboo, and we don't have to buy into those stereotypes and stigmas, etc. So I said to him, what's going to happen with my clitoris? And he said, I'm not going anywhere near your clitoris. And I said, define the word near, because, like when you've got your head between my legs, like you're in proximity, like you're going to be close. And he's like, it's fine. It'll be fine. It'll be fine. This is not his exact words, but this is the gist of it. He's like, trust me, it'll be fine. And then after the surgery, I think there's so much pain and then pain medication and sort of all the other issues to deal with, all the wrangling of the bowel and the bladder, being confused and all that stuff. I just felt really numb and sort of disconnected from that whole area of my body. And I was just really worried because you're not allowed to have sex for quite a while. And then I said to him, so at my 6-week checkup, I said, well, when you say you're not allowed to have sex, what do you like? What are and aren't you allowed to do? Because in the Facebook groups I'm in, people talk about they can do this, but they can't do that, and they can do this. All the surgeons give completely different advice, obviously. So you have to go with your own surgeon's advice. And he was like, well, I don't really want to go into the ins and outs of what you actually do in your sex life. And I'm like, babe, same. Like, I don't want to go into that with you either. I don't want to go into the detail, but like, okay. He's like, so what I mean is no intercourse, nothing that could interfere with the stitches for 6 weeks is what we say. And I'm like, yeah, I know, no intercourse, but what about outer course? And he said, outer course? Is that a word? Did you make that up? And I said, I don't think I made it up, but no, I didn't, right? And he's like, I've never heard that before. And I'm like, I just made your job so much easier, didn't I? Because now you know how to talk about this in other ways. And he's like, outer course is fine. Like, that's fine. You got to ask the questions. Like, it's your body and it's the things that mean the most to you. You have to be quite brave, I think, and actually bite the bullet. And they're not necessarily going to just give these answers. So that'll be one piece of advice I have for people if they're thinking of going through surgery is write your questions down and just be as matter of fact about them as you can. And remember, surgeons find things uncomfortable too. Sometimes we have to unfortunately lead the way a little bit. But yeah, to be explicit and ask about what you really care about. And the exciting thing is the wiring still works. Like for me, it definitely still works. But it took a while to get there because I had felt really numb and really, yeah, as I say, disconnected from that whole and kind of confused about everything because it feels so different. So it was very exciting to find that it actually is all still, online.
There's some statistic, and I've forgotten what it is, but it is statistically been shown that physicians, healthcare providers do tend to be quite uncomfortable talking about sex. It's not that they don't want to, it's just they don't even know how to bring it up. So this is I'm really glad you brought that up. It's not that they're like, don't talk about it. It's just they feel awkward about it. They're not really sure how to broach the subject, if it's even necessary with the patient. So if it's a question you have, ask it because your surgeon or your provider just may not know that you're interested or curious and they don't know how to open the door to that conversation. So I'm really glad that you shared that. Let's go ahead and bring this home. I really appreciate that you shared that advice to write down your questions. I think that's really, really good advice because you will forget them. At least I do. When I go to the doctor, I forget. And so that's wonderful. Let's kind of bring this home with any last words of advice that you might have for anyone who is going through something similar to you, who may be considering surgery or maybe has recently had surgery. I don't know, any last words you'd like to leave people with?
I wish, and I think it's just work in progress that we're all still contributing to this. And even by having this conversation, we're hopefully adding to what's available for people because I could find so little that was useful to me beforehand online. That's about lived experience of these surgeries. You can find lots of things about lived experience of hysterectomy, for sure. And that's good. That's useful. But if you're having prolapse repairs, it's a lot more going on. Like I felt like the hysterectomy was the least of my problems in terms of recovery. And so I guess that's where I actually hadn't really told, like I told friends about having prolapses, but I hadn't kind of outed myself about it until I had the surgery. And I tend to write a lot of diaries online when I go through big things. So I'm writing a book and I kind of try out material for either my book or for comedy or whatever. I try it out by putting it on my private Facebook page and seeing what kind of dialogue happens or conversations happen with my friends on there. And so when I was going through surgery, I did a surgery diary. And that was the first time I talked about pelvic pain before and how debilitating it was. But this is the first time I'd actually talked about prolapses. And it's so hard to come out about prolapse, right? And I think my advice is that those of us who feel like we can be a bit more out about these things, maybe we can and should, because, and I'm not saying everybody should, because it's not for everybody. Some people are much more private and we can all put boundaries around our own information. We don't have to share it with anyone we don't want to. But it's kind of like being queer as well, like being in a relationship with another woman. I have to choose whether I come out all the time. Yeah. Like all the time, people assume that I'm heterosexual. And so I just have to kind of make these constant decisions, often on the spot, about do I correct them or do I say my wife or do I say my partner, which then hides her, being a woman. And so I kind of feel like being out about this, about prolapses and being gay. And I thought that's really, that is a measure of how messed up our society is about talking about women's bodies and the really intimate parts of our bodies. So much stigma. The word pudendal comes from a Latin word that means to be ashamed of or embarrassed about. Like, that's the name of that nerve that I have all this trouble with. Mm-hmm. And it's bananas. And I remember talking to a friend really early on about when everything had just gone completely chaotic for me with my health. And I was like, I've got all this stuff going on. How is it that I've worked as a clinical psychologist for more than 20 years? People have told me about the most intimate, troublesome parts of their lives. And I mostly work with women or trans and non-binary people. And not once has a single person talked about prolapse. Not once. I've heard about every other thing that can possibly be hard for humans to deal with, I think. But never once has somebody mentioned prolapse. And given the statistics that you talked about earlier on, a lot of those women at some point in their lives will have prolapse. They may or may not know, but they will have them. And so I was talking to this friend, and we're talking online, and I'm crying, and I'm saying, I can't even talk about it with people. And she's like, we can. And then I thought, oh yeah, that's true, because I'm telling her right now. Of course I can. And so I've actually just started to be much more open about it. And when I kept my diary going through surgery, I got so many comments. I got nothing negative. I don't know what negative thing I even thought would happen, except people might be like, oh, too much information. But I think if people do think it's too much information, I encourage them to think, why do you think it's too much information? Like, just kind of gently inquire as to why that's uncomfortable for you as the listener. I appreciate it's not for everybody, and if that's fine, don't read it, or look away or mute me or whatever. But actually, it's really helpful for other people if we can just be more out about it. Yeah. And I really appreciate all that you've done over the years. I don't know where I'd be now without you, honestly. And I don't mean that in a general sense. I very specifically mean I do not know where I would be right now without you.
Thank you. I'm going to receive that right now. I'm just going to take that in. Mm-hmm. Thank you.
And I think you have that impact on, I think, tens of thousands of people probably. I have it on a very little scale. And it's not a scale, it's not a competition. But I think, people need to lead the way, which is what you did. You talked about your own experience. And I hadn't heard other people online talking about their own experience of having a prolapse. I'm like, thank God it's not just me. It really matters. And I think there's a lot of communities now, which are great. But actually, we need some celebrities to come out. I seriously believe, we've got, Angelina Jolie and what she did for the BRCA gene and ovarian and breast cancer risk, and Lena Dunham and Whoopi Goldberg talking about endo. We need some celebrities to come out and just talk about prolapses. Mm-hmm. And there must be so many of them that have them. And they can't just have surgery to fix it, because the surgery is not just to be all and end all fix, So any surgeries watching this, the floor is yours, go for it, because it would be so helpful. It's like how I'm so grateful to the people who were gay decades and decades before me, which paved the way for me and my life and all the people of our generations to not have life be so hard. Yeah. And I do equate it to this. I think it's another form of outing. Yeah. It shouldn't be, but it actually does require that bravery of some of us. Mm-hmm. And so even in little ways, if people feel like they can just be a wee bit more open, and just give other people a chance to learn, because I think people don't know. They can't help, because how could they know? Because it's not talked about. So we have to talk about it.
Absolutely. To that end, I'm going to put links under this video description. So in the video description here, Nicola, if you can send me the Facebook group for surgery that you had mentioned, and then any other pertinent links that you'd like to share with me, I will add those to the video description. I also did create 2 videos called Teach Our Teens. They're not widely viewed, but they're really good. And I really wish that they would be shared, because I know that teens don't necessarily care, and I get that. I get it, because they don't know the impact and the importance of this. Most people don't know the impact and the importance of it until it happens to them. And that's the honest truth. And they don't particularly care until it happens. Because as you said, Nicola, at the beginning, you thought of prolapse as kind of an old person's issue, And so people don't understand just how common it is amongst women of all ages, and pelvic health issues amongst people of all ages, all genders, all people, all ages. So I'll put the links because anyone still watching this, thank you for still watching this and for your interest and for doing what Nicola says, which is to let's remove the stigmas. Let's spread the word, because that's just going to make people that much clearer about what's going on, how to at least take steps to try getting help, where to go. And then if they need surgery, they'll know, how to be in a good headspace for that surgery, what questions to ask, and they'll recover better. So, I mean, it's a huge ripple effect, just knowledge. Knowledge is power, and it's a massive ripple effect that can help so many areas. So please check the video description. And Nicola, thank you for your time and for your wisdom and for being a warrior for this cause, and for your humor along the way. So
if anybody wants to get in touch with me, they can contact me through my website, which has absolutely nothing to do with this there content-wise at the moment, but you can always connect with me through it. And it's just www.nicolabrown.co. So we can put that link there too.
I'll put the link.
I'm happy to have conversations with people about it.
That's very generous. Thank you for doing that. So, okay, all the links will be in the video description. And thank you again, Nicola. And if there's any last words, go for it. Otherwise, I'll just sign off with a goodbye. And thanks to everyone for watching.
No, I think that's it for me. I just feel really strongly about the power of openness and having these conversations. So I really appreciate the invitation and the platform that you provide, and the treasure that is your content. Like, nobody could ever, I think it would have taken an entire lifetime to get through all of your content.
Yeah, I think so.
I don't know how one human being has done it, to be honest. So I'm so appreciative of all that you do, and all the other women who are leading the way in this field too. Like, there's a pretty cool bunch of pelvic warriors.
Yeah. Amazing. Okay, well, thanks again, and we'll see you all next time. Bye-bye.
Bye.